Hi to everyone tuning in from wherever you are around the world. My name's Eric Grant and I'm the Communications and Media Manager for the Union for International Cancer Control. Welcome back to the World Cancer Day live broadcast program. I'm joined today by Kirstie Pomaranski of the Life with Cancer program in Fairfax, Virginia in the United States, who will be taking us through the importance of physical activity for people living with cancer. Kirstie, thanks so much for joining us. How are you doing today?
I'm doing great. Thanks to be here.
Great. Well, I think it's a really important topic, but just before we get to the importance of physical activity, perhaps you can tell us a little bit about the Life with Cancer program and what you do to support people with cancer and their families.
Absolutely. After having my own cancer diagnosis 7 years ago, I jumped at the opportunity to become part of a health system that helps support people that are impacted with cancer. So I joined Life with Cancer. They're a nonprofit organization based out of the Washington, D.C. area. And we provide free psychosocial emotional support to individuals and their family members that have been diagnosed. And so that can look like counseling, it can look like nurse navigation, fitness and nutrition, oncology, massage, acupuncture, and art therapy.
Great. Well, thank you so much. Now, as you said, you yourself have firsthand experience with cancer. Can you tell us why it's important for people with cancer to engage in physical activity? I mean, I can imagine that may be the last thing you want to do if you're going through treatment.
Yeah, absolutely. I know firsthand the trauma of this diagnosis. And so using exercise as a way to mitigate that stress and really get through this challenging part of your time is one of the best things that I could recommend. Evidence also is pouring in over the last decade, and it shows that our quality of life improves because of continued exercise during treatment. It helps improve outcomes, meaning you're retaining your muscle mass. You're able to stay on course with your treatment protocols like chemotherapy and radiation more consistently. So that's going to definitely improve your odds of survivorship. And it's also going to help actually reduce fatigue, which is one of the most common complaints that we receive for people that are going through treatment like chemotherapy and radiation.
Great. That's very important to understand. And just, feel free now to start on the routine you want to show people, because I know people might have questions what they can do, what they can do at home. Is there anything they can't do? So, please.
Okay, so I will just start by prefacing that, we're going to be wanting to look at 150 to 300 minutes of moderate activity during the week. So that would translate to about 30 minutes of aerobic-based activities. So walking, biking on a flat surface, it could look like dancing or even housework. Also making sure that you're strength training 2 times a week. That has really, studies have indicated that this is really important. And so using, your body weight to begin with, you need to take into consideration your current health history. If you've been exercising prior to this diagnosis, you also want to take into consideration your treatment protocol, where you are in your treatment. If you're getting ready to have surgery, you can certainly use exercise as a way to channel that anxiety and get ready for that surgery so that you'll have a faster recovery time. You'll want to make sure that you're following your doctor's advice post-surgery, and usually we're going to wait 4 to 6 weeks to recover, but that doesn't mean that you should avoid activity. You should actually be moving and moving often. So that would look like walking, gentle stretches, obviously taking into consideration your doctor's recommendations first and foremost, but continuing to move during this time is really important. On the days that you're receiving, your treatments, you will probably have a cumulative effect for chemotherapy, so you might start to feel fatigued. And you'll want to ease back and honor those limitations for the day. So I'm going to show you a quick no equipment circuit that you can do at home anywhere. And really all you need is a sturdy chair and some space to move freely. So let's begin. I'm going to have you anchor yourselves in a chair. And if you're watching, you can certainly observe or follow along. Like any exercise program, you know your body best. And so you're going to want to take that into consideration as you move through this program. So if there's something that doesn't feel right to you, honor that and move to something that you can do. Always look to the what you can do versus what you can't. That's a good way to frame that thinking. So let's anchor through our feet on the floor. Let's make sure that we're evenly placed in our chair. So just rocking back and forth, taking notice how we feel prior to this routine. And I want you to place your hand on your navel. So sitting up nice and tall, this is a great activity for creating mindful awareness of our posture and also using breathing techniques to help interrupt our stress mechanisms. So let's breathe in for 4 breaths, hold for 4 seconds, and exhale, beginning now. So breathing in, down, expanding into our navel region, hold and exhale out through the mouth. Breathing in, hold and exhale. We'll finish with one last final breath before we transition to our next movement. Breathing in, hold and exhale. Let's begin to just warm up our soft tissue, and we're going to roll those shoulders down and back. So just taking notice of how we feel. How is our posture? Are we sitting nice and tall? Are we continuing to breathe? We'll roll our shoulders to the front and begin to take those hands and place them on top of your shoulders. I'm going to have you just bring those elbows, open them, and then stretch. So if you've had a surgery where you might have expanders placed in your chest, you're going to notice that this might feel tight and uncomfortable. So you're going to want to ease back in this stretch. But this is a great way to help increase circulation and promote lymphatic drainage. So sitting nice and tall, continuing to breathe, noticing the muscles that you're using to make this happen. Just ever so gently, we're opening and stretching the chest, but we're also contracting the chest muscles. So we're going to move on to our next exercise, which is great for helping to stabilize the shoulder. I'm going to have you raise that arm. And as you raise, we're going to give ourselves a little squeeze in the fist. Nice and slow, ever so gentle, continuing to breathe and sitting nice and tall in our chairs. So this is great for promoting circulation, creating shoulder stabilization, and you're going to want to work in a range of motion that feels comfortable for you and where you are in your treatment plan. Excellent. Let's go 3, 2, and then the last one. Crossing the hands over our chest. I'm going to show you guys a quick workaround for squats. I get so much feedback that people hate to do those squats because it hurts their knees. Well, guess what? We have to do this when we stand up out of a chair. So I'm going to have you focus on this for the next 30 seconds or so. I want you to hinge forward in that hip, lowering slowly till you feel that chair. I'm going to have you stand, squeeze the muscles on your backside, and actually activate that pelvic floor. Continuing to breathe, working at a pace that feels right for you, and working on this lower body endurance. So just cross those hands, trying to avoid using your hands to get up out of the chair if possible. This exercise can significantly reduce the risk of falls, and this is something we have to do for life. So we're going to move on in about 3 seconds here and get ready for our next exercise, which will be the cross body punch. I love this because you can really tune into your breath here, and you can also work your obliques, your abdominals. So I'm going to have you ball your fists. We're going to reach across the midline of the body, sitting nice and tall, and I want you to make a ch sound. So you're really forcing air out through the teeth and ch, engaging your abs as you punch out in front. So continuing to breathe, ch, 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 going at a pace ch, that feels good for you. Remember, you should be able to say your name, have a conversation, but not necessarily sing. So this would be considered moderate depending on your current fitness levels. Let's go for 3, 2, and then last one. Let's reset that posture, bringing those legs together. I'm going to have you place your hands between your chin and your chest. And I want you to press those palms together as if we were going to squish a pancake. So this is an isometric chest hold, excellent for building endurance after chest surgeries. And then I'm going to have you interlace those fingers and pull them apart. Try to pull them apart, and we're going to stabilize the shoulder with this activity. So sitting nice and tall, we're continuing to breathe. Notice how we're feeling. Are we feeling warm yet? All right, excellent. Drop those hands to the side of your hips, and we're going to begin to lift those knees. This is a great activity that you can use to fill 3 times. So if you're watching TV with your family or friends and you want to get more physical activity, all you have to do is lift those knees and pump those arms. So this is all inspiration that you can use to apply in your everyday life. Smile on the face helps with air intake. And we're going to transition to our next movement in 5, 4, 3, 2, 1. Excellent. Placing those hands on the hips, I'm going to have you extend the leg out in front, and taking notice of squeezing the muscles on the front part of the thigh. For extra credit, you can certainly add some arms. So lifting your arms up, you're working more muscle groups and being more efficient with your time. We'll move on in 5, 4, 3, 2, and then last one. So we're going to begin to pull those heels to our glutes and adding a bicep curl. So this is a way to work the back sides of our legs and our arms. Notice I'm not using any weight, but I'm using the power of my intentions and thoughts to create resistance. So I'm imagining that I'm lifting 20-pound dumbbells right now, but I'm not. I'm just activating those muscles with my mind. Keep going. We've got 3, 2, and then the last one. Excellent job. Let's bring our feet over to the sides of our chairs. We're sitting nice and tall. I'm going to have you raise those legs up as if we were stepping over an imaginary gate. So this is really going to help work those hip flexors and help with fall prevention. We really want to make sure we're doing this because one of the side effects of chemotherapy can be a little bit of neuropathy, which makes it challenging to feel the bottom of our feet. So making sure that you have strong hips, strong lower bodies can help prevent falls. So let's go 3 more, 2, and last one. Remember, continue to check in with yourself. Am I working at a pace that I can still have a conversation, but not necessarily sing? That's the goal. So leaning back in your chair, legs are extended. We're going to throw out those arms and then bring them back into the midline. This is our star jack, okay? This is a great way to get that heart rate up. We're going to challenge our right and left brain. You can work opposite arm to leg. See how I want to throw both legs out? Excellent. Just reach. Try to avoid sitting back in that chair and really engaging those abdominals. Excellent job. All right, so we're moving on. I'm going to have you hinge forward in your chair. Make sure your bottom is planted flatly. We are going to make sure our spine is straight. We're going to drop the hands to the side of the ankles, pull back, and squeeze. So this is a great exercise to help combat our modern living, using computers a lot. That tends to pull our bodies forward. And this is just going to help strengthen those muscles on the backside that help hold us upright. So transitioning to our last and final movement, drop those hands, come right on back up. Let's square ourselves and check in with our posture. We've got heel to toe raises. So we're lifting those heels, lifting those toes, and just rocking back and forth. This is great for promoting circulation in the lower extremities, helping to avoid lymphedema if possible. And it's also an exercise that you can do to combat sitting a lot. So continuing to notice how you feel, continuing to sit nice and tall, and continuing to breathe. So let's check back in with ourselves, noticing how we feel. It's been about 10 minutes, you guys. Let's place that hand on the belly. Let's breathe in through the nose, holding for 4, and exhale for 4. Let's repeat this 2 more times. Breathe in, hold, and exhale. One last final time. Breathing in, hold, exhale. And let's think of one thing that we're grateful for, and that's me being here with you today.
Thank you so much, Kirstie. That was fantastic. And I just want to remind everyone, this will be available on the World Count Today YouTube channel if you want to come back. Obviously, a lot to remember, but those are fantastic exercises anyone can do at home. And I also just want to come back to one thing you said, which I think is really important on World Count Today, the mindset. When you said let's focus on what we can do, not what we can't do. I think that's a really important message. And just to finish up, if you could let us know what World Count Today and the Close Care Gap campaign mean for you, Kirstie?
Absolutely. I think as humans, we are all connected. And it's my personal belief that we have a moral obligation to one another to empower and to inspire others to take care of themselves. This has a ripple effect so that when we do this, our communities get healthier and it spreads around the globe. So that's really what closing the gap means to me. So
true. Thank you so much, and you have a great day.
Thank you. Have a great day.